hormonal birth control is the most prescribed medication for women. Women who are 15 to 18 years old, approximately 38.7% of them are on birth control. Years 20 through 39 years old, 70 to 90%. Women who are 40 to 49 years old, 75%. A lot of these vitamins and minerals that cause mental health issues, anxiety, depression, ADHD, schizophrenia, bipolar disorder, birth control depletes those specific vitamins and minerals. Hello, welcome back to another episode of She's in Sync. Today, we're going to be diving into a conversation around birth control and mental health again, but this time with a focus specifically on nutrients. And I have to tell you, after my last episode on birth control and mental health, the stars just aligned. I had so many women coming to me, chatting with me about their anxiety being out of control, their depression being really, really bad, just not feeling like themselves, and a couple of clients of mine who are struggling with that as well. So I went down a rabbit hole. If you don't know what I'm doing, I am either sweating in my hot yoga dome or my sauna in my basement, or I'm going down a rabbit hole of women's mental health. There's just always so much to learn and dive into. Or I'm hanging out with dogs. It's either of those three options. But I went down this rabbit hole of diving even deeper into the relationship between birth control, mental health, and I stumbled upon a different kind of avenue, which is specifically related to nutrients, so vitamins and minerals. And I am so on board with the impacts, the positive impacts of having enough nutrition and vitamins and minerals. I mean, I mineral test with all of my clients. It's the most important test. If you were to choose anything, I'd choose the hair tissue mineral analysis. I have a whole episode dedicated to that and talking about why I love minerals. And vitamins are just as important too. We can make some vitamins versus we can't make our own minerals. So that's why a lot of times I harp on minerals a little bit more. But anyways, I started reading this book about that, and I read some research articles, and I attended a couple webinars focusing specifically on nutrients in relation to mental health. And I quickly made these connections that a lot of these vitamins and minerals that cause mental health issues, anxiety, depression, ADHD, schizophrenia, bipolar disorder, a lot of these things, birth control depletes those specific vitamins and minerals. So I knew I had to just, I put my thoughts together and came up with this episode. So I'm so excited to dive into this with you. And if you haven't listened to the previous episode about birth control and mental health, that was a couple weeks ago. Go back and listen to that. This will be a really good part, almost like part two to that. The first thing I'm going to start out with are some statistics. So hormonal birth control is the most prescribed medication for women. That was something I kind of knew or like postulated. But in one of these webinars I attended, this naturopathic doctor, confirmed through her more recent research that hormonal birth control is the most prescribed medication for women. Women who are 15 to 18 years old, approximately 38.7% of them are on birth control. Years 20 through 39 years old, 70 to 90%. And that's the area of women that I see the most in my practice. So the average woman I work with is in her 20s to early to mid 30s. I have worked with women who are older and younger than that, but I would say like my average, the woman who's coming to me for support transitioning off birth control and or having negative side effects from birth control is within that 20 to 39 year old percentage. And then women who are 40 to 49 years old, 75% of them are still on birth control. And a lot of things I'm seeing, or a lot of times more recently, I'm talking with women who are older. And the big thing right now is menopause. And I do work with women who are in more of that perimenopause era. I am very upfront that I don't specialize in menopause, depending on what their symptoms are and what their goals are. But I do work with quite a few perimenopausal women who want to be proactive and get their hormones in tip-top shape in that transition of their life or before that transition of their life, because a lot of them have been on birth control for so long. And sometimes, even now, doctors are recommending women go back on birth control as they are entering menopause to quote unquote regulate their hormones. There's a big problem with this. That's, an episode for another day. But I wanted to preface with birth control is the most prescribed medication for women. And a lot of times it's not prescribed for actual pregnancy prevention. It's prescribed for things like acne, painful or missing periods, heavy periods, cramping, endometriosis, PCOS, all of these things that don't actually get to the root of, well, why is that happening? We need to do the deeper digging versus slapping a band-aid on it, aka synthetic hormones in birth control that have these ramifications long term that women are not aware of until they are struggling with mental health. They're struggling with infertility after stopping, their period doesn't come back, etc. Another stat I want to share is that women are 2 times more likely to be diagnosed with major depressive disorder versus men. And keep in mind, too, it's better now. And this is coming from someone I used to work when I was in eating disorders for over 8 years. I worked in the mental health space. It's harder to get this data on men because they are not as open or about mental health just due to societal norms around what is and isn't appropriate emotionally for men, and they're less likely to seek treatment. So this data is probably skewed that way, but from what we know, women are 2 times more likely to be diagnosed with major depressive disorder versus men, and 21% of women use mental health medications versus 11% of men. Again, that's probably underrepresentative of both genders, I would assume, but that is the stat that we have. And then specifically, if we hone in even more on those women who are using hormonal contraceptives, this is a stat that I shared in my previous episode. I'm going to share it in a different way now. Those diagnosed with depression, those who are 15 to 19 years old, are at 2.2% increased risk for developing depression. Those who are 15 to 34 years old are at 1.8% increased risk. And specific types of birth control are more susceptible to increased mental health concerns. So, for example, the patch, research shows it's 100% more likely that you'll be diagnosed with a depression diagnosis. The vaginal ring, 60% more likely. Hormonal IUDs, 40% more likely. And one webinar I recently attended, they did a specific study on postpartum women and women who were postpartum 1 year after having baby. If they started hormonal birth control, they were 49% more likely to struggle with postpartum depression compared to women who did not struggle with postpartum depression after having a baby and were not on hormonal contraceptives. So overall, when I was looking at these stats, I knew these things deep down. Again, I have a whole other episode about this, but when I went down this rabbit hole and really compiled it all into this list, I was like, there is such a clear link between, one, birth control being prescribed for everything, right? Like you got acne, birth control. You got endometriosis, birth control. You got painful periods, birth control. And women are a lot of times being prescribed this when we are still growing and developing mentally around, right after we get our first period, depending on the person, when we're in our early teens. And that makes us way more susceptible to struggling with mental health things down the line. And this is something that doctors never talk about, it's bad enough that we don't, as women, know these risks up front. And that's my biggest thing is I want to be informed. I knew that if I was given this information at 18 years old when I was put on birth control, I was put on it, if you don't know my story, for a missing period. It was actually an undiagnosed eating disorder. If my mom and I were told you have a 2.2% increased risk for developing depression or anxiety, which I definitely do have anxiety, I probably would think twice about that. You know what I mean? Versus what the information was given to me and my mom was, okay, your period is missing, take birth control. You're going away to college anyways, so you might as well, assuming that I'd be sexually active. I was not my entire time in college. And you can just stay on it till you want to come off and get pregnant. So that is how my story goes. That's how a lot of stories go, is being put on it so young when we're more susceptible to the mental health ramifications of that. And then those things just build up over time. So as we'll dive into, birth control, its mechanisms, it depletes certain nutrients that the brain needs for optimal functioning. And before we dive into that, the more meds you're on, the more likely you are to start spiraling into like this uh what did someone say? It was like a poly medication, or I don't know. She said it much better than that, but it's basically when you just are put on, like, let's say you're put on, I'll use myself. I was put on birth control at 18 years old. At age 27, I started anti-anxiety medication. The more you add on, the more side effects you have. And then you might need another medication, or you might be prescribed. You don't need, if we're getting to the root cause, but you might be prescribed another medication to help with that. For example, I work with a lot of clients with digestive issues. So maybe they're on birth control, which negatively impacts your gut, leads it to be more likely that you are going to have dysbiosis in your gut, overgrowth of bad bacteria, low levels of bacteria, inflammation in your gut. So then you start a PPI for stomach acid, and that has negative implications. And your gut and your brain go together, right? So then you've got this PPI working against you mentally, and this birth control working against you mentally. So then you have to start anti-anxiety medication. So you can see how all of these add up. And I want to say right from the get-go, I am not against medication. I currently am taking Lexapro, and it has been so helpful for me. And after all of this information that I have gotten, you bet my bottom dollar I'm going to be working on some of these things to try and get myself off of it based on what I have learned. But I do think that it's necessary, it's important, it's good to have options when you need it, because I get it. When I was at the lowest of my low with my anxiety, I wasn't sleeping, I was anxious all the time, like it was impacting my relationships, my work. I just needed that medication, and that's 100% okay. You got to do what you got to do. So this is not to shame anybody for using medication, or to choose, if you choose to use birth control or whatever. This is to provide you that information that you should have gotten before starting said medication, specifically birth control. If there were more commercials about birth control, when they have all these medication commercials, and they have the happy person dancing or like living their best life, and then they just do like the voiceover of all the like, this can cause stomach cancer, and this can cause stroke and heart attack and all these things. Like, if we had one of those things for birth control and you actually listen to it, it would be kind of scary. So these are things we just need to know and be informed about. So that is the whole purpose of my business, what I do, this episode. Okay. So it is not to shame. It is not to, sway you in one way or the other. That is not my agenda. My agenda is for you to have all the information you need to make an informed decision that is best for you. So now that we got all of that out of the way, let's talk about 5 mood critical nutrients and how birth control affects them. Okay. So the first one is zinc. And I briefly talked about zinc in the last episode, I believe, because that and copper interact. But zinc is an important mineral, and it helps to produce serotonin and GABA. These are 2 calming neurotransmitters that keep our emotions steady. Zinc also helps support gut health, immune function, and mental clarity. It's also really important for energy. So whenever I have a client on zinc, I recommend they take that earlier in the morning, because it can be more energizing, especially if someone is like super depleted in zinc and they start taking that. Birth control depletes zinc directly. It also indirectly depletes zinc because of birth control's impact on the gut. So as I prefaced a little bit earlier, birth control can cause dysbiosis in the gut. where there's an overgrowth of bad bacteria, low levels of good bacteria, inflammation, aka what some people think of as or call leaky gut. When this dysbiosis or inflammation in the gut is present, it makes it so that we can't absorb certain nutrients. Even if we're supplementing, even if we're consuming them from food, we're not absorbing them. So that's one really big thing I look at with the functional labs that I run with my clients is not just their levels, but how are you absorbing that nutrition from food? Because we can supplement all we want. We can focus on, say zinc rich foods, but if we're not actually intaking that and our body isn't able to utilize that, we need to get even deeper and uncover, well, why can't your body take that in? And a lot of times that's due to that's dysbiosis, low stomach acid, just the inability to digest and absorb those nutrients from food. So birth control does negatively impact zinc directly. It negates that, and indirectly through its impact on the gut. So deficiency signs, these are going to be, some of them will overlap, of course, but I see a lot of low energy, anxiety, mood swings. Some people can have breakouts, always getting sick. That's a big sign. And another lab to look at with this is copper because they have an inverse relationship here. Top food sources, if you think you might have a zinc deficiency, we'll talk about like how to confirm that later. But top food sources are oysters, which I know that's very hit or miss for people. And grass-fed beef, pumpkin seeds are really great. So like throwing pumpkin seeds in your oatmeal, in your smoothies, and trail mix and yogurt, that's a really great way to bump up the zinc. Lentils and chickpeas specifically are great food sources of zinc to incorporate. The next one is copper. So I did talk about copper last time, but I want to talk about it kind of on the flip side. So I paid a lot of attention to copper overload because that's what I see the most in women that I work with. So just as a reiteration of what I talked about before, excess copper oftentimes can be tied to long-term birth control use because estrogen and copper have a synergistic relationship. So when you're taking a birth control that has artificial estrogen in it, especially if your body can't detoxify that appropriately, and birth control negatively impacts your liver health, it has to detoxify that. It puts burden on the liver, plus all the other things the liver has to detoxify. Then that estrogen rises, and that can simultaneously cause a rise in copper. Some people with the copper IUD, which is a non-hormonal IUD, have high copper, but I do see that quite frequently. The other flip side of things that I didn't mention that I want to shed light to is low copper. The same symptoms can be true for either high copper or low copper. So racing thoughts, panic, insomnia, joint aches and pains, irritability, breakouts, inflammation, those are all symptoms of high or low copper. So that's where it's really, really important to test. And a lot of times I'll see high copper, low zinc, or I'll see both of those things low. I like to see, if you want a frame of reference, I like to see both of them in the blood around 100-ish. So most people are low in zinc, and some people are either high in copper or low in copper. I see especially my women who have been on birth control for a long period of time and or maybe have a history of disordered eating, they tend to be the ones that have the low copper levels, and that can most certainly be related to mood imbalances. Magnesium is the next one. Magnesium is very calming. It calms your mind, it calms your muscles, it calms your mood. It supports hormone detox, and it also is really, really helpful for blood sugar regulation. So if someone has an imbalance in magnesium, that can most certainly play into mood disturbances. And fun fact, magnesium is the first mineral to be depleted when you're stressed out, and birth control does deplete magnesium. So think about how many of us are probably stressed and how many of us have been on birth control before in our life. And magnesium is really hard to get enough from food. I will say that. So this is one that I typically will supplement, but we also want to be really careful because of the synergistic relationship between minerals, right? That's why I never will blindly supplement. We need to just check all of our bases because we don't want to waste your money or your time or make things worse by, let's say, supplementing magnesium if you have low sodium, for example, like because magnesium can lower sodium, which is good if you might have high sodium. But if you have low sodium, we want to be like really cautious with that. Deficiency in magnesium can lead to anxiety, depression, cramps, insomnia, just feeling like emotionally fragile. Also, blood sugar dysregulation is a big one with this that I look out for too. Foods high in magnesium, again, I like to supplement with this, but also the other thing I'll say too is there's different forms of magnesium. There's different forms of all these vitamins and minerals, but I do really tailor the magnesium that I recommend for each of my clients based on their labs and their symptoms. So, if someone is more constipated, for example, I might recommend them start with magnesium citrate because that helps loosen the bowels. If someone is more anxious or has trouble sleeping, I might recommend magnesium glycinate. If someone is like really low in energy, magnesium malate is a really good form. So it's important not just to supplement with something and know that you need to supplement with it, but also to know what form is the best. So foods that are high in magnesium, spinach, pumpkin seeds again. So pumpkin seeds are really great for zinc and magnesium. Avocado, dark chocolate, and almonds. B vitamins, specifically B6, B12, and folate. These are your neurotransmitter builders. They're the carpenters that make serotonin, dopamine, and GABA. For example, B6 converts glutamate into GABA. B12 and folate fuel methylation, energy, memory, and mood. So just as like a heads up of what methylation is your body's internal like switchboard. It turns on and off key functions like mood regulation, detoxification, and hormone processing. So when methylation is working well, your brain is making neurotransmitters efficiently, detoxing, let's say, excess estrogen or toxins, and keeping inflammation down. When it's sluggish from, let's say, low B12 or folate, or this is a genetic mutation, everything slows down and you can feel flat, foggy, and anxious. So I just want to preface that because it took me a long time to understand like what methylation actually was. So I like to give kind of like that analogy. But your B vitamins are really important for all of that stuff. And birth control does directly deplete B vitamins, and it also indirectly depletes it because B vitamins are absorbed in the stomach. So when we have low stomach acid or dysbiosis, which can be propagated by birth control, that can make it so that we're not absorbing those B vitamins. You want to be careful with this one too. Just a PSA for my acne girlies out there, because that's a big piece of my story too. B vitamins some of them can cause acne breakouts, not all of them. So I have better success with B6 compared to B12 in practice with my acne prone women. But this is another example of you just want to be cautious with supplementing this. You might need them. And oftentimes I will talk with clients about if someone's really, really low because of its impact on mental health. So sometimes I will tell people, my clients with acne who they have really low levels of B vitamins. If it's like a B12 or something that might trigger acne, it doesn't always, but sometimes I'll recommend instead of taking a supplement that they look into getting like a B12 injection, which is like where they like those places that do the IV vitamins and stuff like that. Because if they're going to break out, it's going to be like right away. But their levels are going to get up a lot quicker versus kind of that slower build and like continuous breakouts if they're sensitive to that. So again, just a PSA if you are someone who struggles with acne and anxiety or other mood issues. So signs that you're depleted in B vitamins, this often leads to brain fog, PMS, low energy. I will look at too, when I'm looking at functional blood labs, I'm looking at liver enzymes too with this. So, I just had a client who she has a long history of birth control use, was put on it for acne. Speaking of, she was on Accutane for a long, like on and off for a period of time. And, she had done a lot of other things to try and fix her acne. And she was struggling not only with that, wanting to stop birth control, lots of anxiety, mood stuff, gut issues. And when we got her labs back, her liver enzymes were actually like quite low. And so I, talked to her. We're putting her on a B6 because that's going to be helpful not only for her liver to help support detoxification because her liver is very overburdened. Even though her liver enzymes are low, it's showing a sluggish liver from the Accutane, from the birth control. And also it has mood benefit to it. When I'm gathering all this comprehensive information, it's so helpful to break it down and look at, okay, what's going to give us the most bang for our buck? So we're not just like doing whack-a-mole with these supplements and seeing what's sticking, but having that data and figuring out based on your symptoms. Because a lot of times it's not just mental health. You're struggling, with other symptoms as well. Maybe it's period issues, maybe it's like low energy, acne, whatever. But these things are all your body's way of trying to tell you it needs support. And nutrition is so foundational to that. And it's really cool when you dive into the research how food and supplements really are medicine, and there's so much more too. All right, B6, good foods for that: turkey, bananas, salmon, and potatoes. B12, eggs, beef, liver, sardines. Just another PSA, liver is the best. It's nature's multivitamin. So if you are someone who likes liver, that's pretty much high in everything we're talking about: zinc, copper, not necessarily magnesium, but B vitamins. It's vitamin A. It's great. And then folate, leafy greens, lentils, asparagus, and avocado, just to give you some ideas. That one's more vegetarian friendly. And then the last one I want to talk about is omega-3s. Omega-3s are really essential for brain health, brain structure, mood, and anti-inflammation. So if we're thinking about long-term disease prevention, anti-inflammatory foods are going to be so supportive for that. And most women don't eat enough omega-3s. They're really most abundant in your seafood. So think like your wild salmon, your sardines, and then also in like walnuts, chia seeds, flax seeds. So ground flax seeds are great. So just think about how often you're consuming those foods, and it's probably not enough. So I will a lot of times put my women on cod liver oil. That is my favorite supplement for omega-3s. It's a really dense form of retinol, which is a really bioavailable form of vitamin A. There's also beta carotene, which is vitamin A, but especially I work with a lot of women with acne. The retinol is really what's going to be super helpful in terms of like skin regeneration, healthy glow, that kind of stuff, and those mood benefits. Signs of deficiency in omegas: low mood, brain fog, difficulty with memory, also acne, inflammation. Those types of things are going to be big. I don't test for omega-3s directly. It's just something that I found through my training and my practice that most women need some of that. So it is one of the most commonly recommended supplements that I give, along with beef liver, depending on what their copper looks like. And it's really helpful for, like I said, like acne, inflammation, mood stuff. Just, it's a really solid foundational supplement to have. So if you're listening to this and you're like, this makes me really curious, does perhaps my mental health tie into being on birth control for XYZ years? It's not all doom and gloom. I want to share some hopeful stuff here. All of this can be reversed. Okay. All of these things can be, when you get the data, when you understand what your body needs, when you understand your deficiencies or excesses or malabsorption issues or dysbiosis issues, all of these things can be, targeted with food, nutrition, lifestyle, and targeted supplements. Okay. So it's really important that you get the right labs run, because standard labs they're not going to test copper. They're not going to test ceruloplasmin, which is what helps transport the copper where it needs to go to do its job. They're not going to look at all the information. And if they do, their reference ranges are really wide. Okay, so when I'm looking at labs, I'm looking at it from a much more narrow lens of what's optimal for women's health in relation to their symptoms and their goals versus standard conventional medicine is looking at it what's normal for men and women. And if you didn't already know this, most health research is done on male test subjects. And they're also looking at, it's normal until it's flagged as a disease versus I'm looking at it from the lens of we want to prevent it before it happens. So what's optimal and what can we do now to not only make you feel better, but to prevent this from spiraling down the road because, a lot of times we're only intervening when it gets really, really bad. My goal is to help women feel better now. Like like a lot of women are just, they don't feel good physically or mentally, but they are just kind of taught like that's normal to feel like that, or like, oh, that's just part of being a woman or whatever. But that's not true. If you're not feeling your best, there's something wrong and so don't let anyone gaslight you. And I do not use that word lightly. I think that's a buzzword right now, but I don't use that word lightly. That's something side tangent. I listened to a podcast by Dr. Jolene Brighton recently. She wrote the book Beyond the Pill. She's an excellent physician, and she was talking all about medical gaslighting, specifically with women with painful periods, and how oftentimes that's a sign of endometrial cancer or endometriosis and stuff like that. But they were just told like that's just part of being a woman. Here's birth control. So I want to also help you give you the tools in these podcast episodes, in my blogs, and my content, or working one-on-one together so that you can advocate for yourself with your doctor. That's also something that's really, really important to me. So running the right labs and then having the right person looking at your labs and having the right reference ranges for optimal health and disease prevention versus, oh shit, we have liver disease, or oh shit, we have diabetes, like now we go on another medication. Or we have really high copper, like your mood is out of control, you can't sleep, etc. Okay, let's go on anti-anxiety medication, which again, nothing wrong with that, but why is that happening? Let's get to the deeper root of it. So how I do this in practice, to give you behind the scenes look, is I run specific targeted labs to test for these nutrient deficiencies. And I do that in two different ways. So the HTMA, which I mentioned earlier, is the hair tissue mineral analysis. This shows your mineral levels for the past 3 months, and it also shows what's happening inside the cell. So for example, certain minerals like potassium, 90% of it is inside the cells, but blood labs are just showing what's outside the cells, and blood labs are just showing that moment in time. So it's not as good of a marker compared to the hair, which is giving you internally what's happening in the cells with your minerals and this 3-month snapshot. It also gives you really good insight into, even if we're not doing a gut test, for example, it can give me really good data of if you might have low stomach acid. So for example, if cobalt is low and phosphorus is low and sodium, potassium are low, then you bet I'm going to do some intervention to help with stomach acid, because that is another thing that is going to inhibit the absorption of these minerals and vitamins if we have low stomach acid. So the HTMA can show us that. It also gives us a really good picture of stress. And this is something, I know it's not sexy to talk about. I know that you're stressed and that you need to work on stress. I get it. And it's really important because if you're stressed, same thing with if you're not absorbing things. If you're constantly stressed and it's out of control, we can do all the intervention nutritionally you want, but if your body isn't safe, it's going to be burning through those minerals like crazy, and you're not going to be able to rebuild them back up. So it's really important to not slap another Band-Aid on it, even if it's a better Band-Aid than birth control, let's say. So I look at things through the HTMA to get that comprehensive analysis and look at gut function, stress, mineral levels over a span of 3 months. And then I also do layer in functional blood work too. So specific minerals like copper and zinc, for example, those are really important. Those are tested on the HTMA, but I like to look at those in combination with the blood labs, because I want to look at the complex interaction between those two, and also other vitamins like vitamin A, like iron. All of those things impact one another. So for example, if there's iron overload and there's low vitamin A, that's going to impact copper levels. So it just gives me an added layer of what actually is going on here. So I can give you a holistic plan. So you're going to have the most bang for your buck versus playing that whack-a-mole of like doing one thing, but then, we're supplementing with zinc, but then we're not absorbing it, etc. That's what will also help me see if there's any other methylation things in the picture. So looking at liver enzymes, homocysteine, for example, B12, folate, all of those things are going to be helpful with that bigger picture. So the HMA and the functional blood labs are two of the labs that I would most certainly look for and do some additional testing on if someone comes to me and they're experiencing anxiety, depression, ADHD, insomnia, any mood issues. So that's exactly why I created the anxiety and PMS track of my birth control breakup accelerator. This is a 6-week program that includes all of those functional labs that I look at and mentioned for mental health specifically. And you also get a 75-minute deep dive call with me to unpack your symptoms, your history, your goals. And then once that lab information comes back, I combine that with what I gathered in that deep dive call, and I give you a customized protocol to help you know exactly what kind of foods to focus on, what targeted supplements to incorporate and are worth spending money on, and specific action steps to get your brain replenished with the vitamins and minerals it needs to function optimally and to feel your best. And then after that, you get 6 weeks of chat access with me so that you're never left, Googling or chat GPTing again or guessing, or if anything comes up that you have questions on. So you also have that included. So if this episode resonated with you, and again, you are, maybe you're on birth control and you are like, ooh, maybe I should look into this more and maybe I should get off of this. Maybe you're nervous about what will happen. Maybe you got on it for one of those reasons that wasn't pregnancy prevention. Maybe you got on it for acne or period issues and you're scared of those coming back. These are all things that can be prevented. You just have to do that prep work ahead of time. And I have all of those steps in my free Breakup with Birth Control Masterclass. So I'll link that below if you want to check that out. I also dive deeper into some of these labs and show actual client data and client examples of real clients that I've worked with. So check that out. And if you're interested in the accelerator or working together in any capacity, feel free to apply in the link below and we'll get you connected with whatever is the best right fit. So to end today, we're going to chat about how I'm nourishing myself. And this actually is great timing because I am nourishing myself by managing my anxiety. So to preface this, like I shared, I am very open about I have generalized anxiety, and I have no doubt that it's part of my DNA, just being a type A, the oldest child, very high achieving, perfectionist. And I do think that birth control, being on it for 10 plus years, being put on it at that vulnerable time at 18 years old, 100% played a role, in my opinion. I think that. So my anxiety is much better, and I do still struggle with it. So the way it manifests for me is it tends to be like a tightness in my chest and really rapid heart rate. That's when I first start to notice it and say, hey, I'm feeling this, got to pay attention. And I'm much better at recognizing that than I used to be. I used to just live off of cortisol. And then it shows up as sleep issues and then digestive issues. So last week, no particular reason. It wasn't one big thing. It was just, I think, a series of things, kind of building up. And I just started to notice that chest tightness, that rapid heart rate. And then last Saturday and Sunday, it took me a long time to fall asleep. And when I was younger, that is certainly how my anxiety manifested into insomnia. So I have almost, little t trauma around insomnia because it just was so anxiety provoking to not be able to go to sleep and to be so tired and to just think about dreading that night going back to sleep and not being able to do it and being stuck all over again. So I definitely have some trauma that comes up when I have sleep issues, even though it's totally normal to have a couple nights off of sleep, and that's okay. It's not going to wreck everything and I can function, but it did happen a little bit for me this Saturday or this Sunday after I had 2 poor nights of sleep, and I was like, "Oh no, is it happening again? Like, am I never gonna be able to sleep well again?" Like, just that spiral of thoughts, which I'm sure if you're listening to this, you can 100% relate to. That's probably why you clicked play. So, what I did and what I've learned is that it's not a sleep issue, it's an anxiety issue, and it's a sign, just like anything and everything. When I get a zit, when I have more cramping in my period, whatever, it's a sign my body's trying to tell me something. So instead of focusing on forcing myself to sleep, I'm looking at, okay, how do I need to take care of my nervous system more? And so, you know, this actually happened last time this year, ironically. And I think it's because I haven't taken a vacation or any time off from work or anything like that since the holidays. And so it's July right now. So it's been about 7 months. And so I'm like, okay, this is good information that I need to have like a mini break or a little vacation in between there. And thankfully, we're going to Boston with my parents in August in a couple of weeks. So I do have that coming up. We're going to Cleveland this weekend to look at wedding venues. So have some fun time in there. But good food for thought for me for next year to be more intentional about that. And I just did a lot of nervous system regulation. And for me, what that entails is telling myself that this almost like affirmations of this isn't a sleep issue. This is normal. Everyone experiences poor sleep sometimes. It's not going to wreck your health. It's not going to spiral. Those types of things, just telling myself that and reminding myself of that. In the past, I've also journaled about those things, and that's been really helpful. Um, I didn't need to do that this past week. And then thankfully, I had a facial scheduled yesterday. And at the facial place I go to, they have a sauna, an infrared sauna. It's actually the same one that I have in my basement, but it's like the legit sauna versus I have the solo one. Mine's legit, but theirs is the one you sit in versus mine is like the little one. So I saunaed, and that's super great for your nervous system. And then I had my actual facial, and she did a like facial massage, and I was just like so tight in my face, like in my jaw. And so she like kind of just literally got that out, and I left feeling so much better. It just completely shifted my mood. I had not experienced that before, but that was just so helpful. And I was able to just like relax, unwind last night, and I fell asleep right away. And so it was really good that was good evidence of like, even if you have 2 poor nights of sleep, it doesn't have to continue. It will end. It's just a phase. It's okay. And I really do think that's from all of the stress resiliency work I've been doing with targeted mineral therapy, with nutritional foundations I've been working on, from the testing I've done on myself, replenishing after years on birth control, and also paying more attention to my signs of nervous system regulation before it gets to the extreme. Because in the past, those 2 poor nights of sleep would have been like a month, right? So the fact that this time it wasn't very long, that's showing me that I can bounce back from stress quicker because I'm listening to it more. I have better foundational health, and I know how to manage it better. That really plays into everything we're talking about today with how to naturally manage your mood that we aren't told. And the other thing I want to mention too is, so I'm a dietitian, right? I have over 6 years of education, professional education, a master's degree in nutrition. I also have a minor in psychology. And I know it's just a minor, but if I wasn't, if I didn't become a dietitian, I would have become a therapist. Like, I just love mental health. That's why I blended those worlds and worked with eating disorders for so many years. So important to me, both professionally and personally. But I didn't learn anything about nutrition and mental health, either in dietetics or in my psychology education. So it's just really, really interesting. And I think that's why I'm going down this rabbit hole so much now is I think there's more of this information that needs to be talked about and more resources to give to men and women about how they can help navigate a better mood and feel better physically, emotionally, mentally through nutrition and lifestyle things versus just being handed a cookie cutter medication that does have side effects to it that they aren't fully informed on. All that being said, thank you so much for listening to this episode. This was longer than I anticipated, but hopefully you walked away with some really good, juicy information. And I hope it was helpful. If you like this episode, please share this one with a fellow woman that you know needs this. I know so many of us are struggling with this. We need to be talking about it more. We need to be putting this information in more hands or ears of women. And if you did like the show, not only share it, please like, subscribe, leave a review on Apple. You can't do that on Spotify, but I would really, really appreciate it, and also helps grow the show so that more women can find it. Thank you so much again. And until next time, stay nourished.